Yeah, I've been on high-dose steroids my whole life before I started Chronicity. It was really hard on me and on my body.
You're absolutely right. The steroids can have so many negative effects on health when the doses are like more than you need to just replace cortisol. Risks of high-dose steroids can include weight gain, high blood pressure, high cholesterol, and low bone density.
It's tough because I know high androgen levels can cause issues too, right?
You're absolutely right. Excess androgens can cause infertility, early puberty, excess hair growth, and acne. So, doctors who are trying to treat CAH with just the steroids really just struggle to balance the effects of the excess androgens with the effects of the excess steroids.
That makes sense to me. So with Chronicity, I'm able to lower my androgen levels, right? So I'm able to take a lower steroid dose.
That's absolutely right. Possibly just at the level needed to just replace the missing cortisol.
Nice.
With Chronicity, we can directly manage androgens, lower steroids, or do both.
That's amazing. It gives me so much hope. I've been on Chronicity for about 2.5 years, and my androgens have been lowered significantly. So that's been a really good thing for me.
That's really wonderful to hear.
Thank you.
Great. Congratulations.
Thank you so much.
Important safety information. Approved uses. Chronicity crinecerfont is a prescription medicine used together with glucocorticoids, steroids to control androgen, testosterone-like hormone levels in adults and children 4 years of age and older with classic congenital adrenal hyperplasia, CAH. Important safety information. Do not take Chronicity if you are allergic to crinecerfont or any of the ingredients in Chronicity. Chronicity may cause serious side effects, including allergic reactions. Symptoms of an allergic reaction include tightness of the throat, trouble breathing or swallowing, swelling of the lips, tongue, or face, and rash. If you have an allergic reaction to Chronicity, get emergency medical help right away and stop taking Chronicity. Risk of sudden adrenal insufficiency or adrenal crisis with too little glucocorticoid steroid medicine. Sudden adrenal insufficiency or adrenal crisis can happen in people with congenital adrenal hyperplasia who are not taking enough glucocorticoid steroid medicine. You should continue taking your glucocorticoid steroid medicine during treatment with Chronicity. Certain conditions such as infection, severe injury, or shock may increase your risk for sudden adrenal insufficiency or adrenal crisis. Tell your healthcare provider if you get a severe injury, infection, illness, or have planned surgery during treatment. Your healthcare provider may need to change your dose of glucocorticoid steroid medicine. Before taking Chronicity, tell your healthcare provider about all of your medical conditions, including if you are pregnant or plan to become pregnant, or are breastfeeding or plan to breastfeed. Tell your healthcare provider about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. The most common side effects of Chronicity in adults include tiredness, headache, dizziness, joint pain, back pain, decreased appetite, and muscle pain. The most common side effects of Chronicity in children include headache, stomach pain, tiredness, nasal congestion, and nosebleeds. These are not all the possible side effects of Chronicity. Call your healthcare provider for medical advice about side effects. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit MedWatch at www.fda.gov/MedWatch or call 1-800-FDA-1088. Dosage forms and strengths. Chronicity is available in 50 milligram and 100 milligram capsules and as an oral solution of 50 milligrams per milliliter. Please see the accompanying full prescribing information or find it at www.neurocrine.com/ChronicityPPI.